stretch. Here we go. Very nice. Wow, that was one of the best ones. I hate to say that, but that was actually one of the best. You all right?
Yeah.
That was phenomenal. I mean, that was really cool.
You know, this is really more intense than it looks on the camera.
Like I said, it doesn't replace with the same stuff.
Yeah.
So our body was made from gold, and then we heal with copper.
Yeah, so the upper back pain is actually started initially a couple of years ago with just one spot right here,
Okay.
right on the left hand side. And then after just a few months, just right this point right on the right hand side, exact opposite point, started having issue.
Okay.
And then after a few months, the left back of the left shoulder
Okay.
started having problem like this area.
Okay.
And then the around maybe this area.
I feel it. So not here,
No.
but more the back part of the.
Mm-hmm. Yeah, I would say around this area.
Okay, just in muscle bellies. Okay.
Yeah, but that has been going on for a while.
Okay.
And now I do train very often,
Gotcha.
right? I
Yeah.
do like anything from lifting or CrossFit type training, a lot of things, and I don't really have any gaps in my training like ever, so I don't know how much that is impacting any of this.
Okay.
But that's one thing. And then I was talking about my upper back pain. Then after a little while, it started sort of spreading out more. So
Okay.
now going up a little bit to the upper traps, and then a little bit down to the mid back too.
Okay.
So that area has been pretty much problematic. Now there is one more. I mentioned the right pecs.
Yes, sir. Yeah.
So that right pecs, way before this one, I had an pecs injury, and then pretty much ever since then, my right pecs gets very pumped up. Like when I do any sort of bench pressing, push up, and stuff like that, gets pumped up a lot more quicker than the left hand side.
Okay.
And even without exercise, sometimes it just gets very tight around this area. The tightness also I experience it here, and then to the neck as well, and then sometimes down to the the armpit, go down behind to the scapula, even to the ribs sometimes.
When you said you had an injury, what do you mean by? Did you have a?
Yes, I was doing an overhead pressing,
Uh-huh.
and then I felt something like a tear, and
Uh-huh.
I heard also something like a tear, and then it started severe burning
Uh-huh.
in this area right
Mhm.
here.
How long ago was that?
That was, I would say, 3 years ago.
Okay. Okay.
And then for about, I would say, 6 months,
Uh-huh.
every time I was pushing,
Yes.
I was having a little bit of pain here.
Okay.
Then that went away, and then that tightness started.
Okay. Yeah. There's an injury and your body healed, and now the tissue can, still, it doesn't replace with the same stuff. Your body doesn't heal with the same material that was originally there. This is where the gua sha, that combing that we do,
Yeah.
that's a really great way to untangle. So you can have tangles in there, and then the tissue, by it being tangled, it clogs itself. And so that has to be untangled in there to actually allow the tissue to be clean in there. And then it'll radiate pain into the surrounding areas. But that's 100% related to that tear you have in there. The shoulder blade is an interesting area because there is some overlap there. Because you're an athlete and you're doing a lot of lifting, overhead presses, there's going to be stress on your lower neck. And there's a poster behind my wife that describes that when there's stress on the lower neck joints, sclerotogenously, meaning that the bone actually refers pain to right between the shoulder blade. So the lower neck and the shoulder blade are not separate. They're the same entity kind of idea. But you also have ribs underneath there. And so you have ribs and joints and muscles. And so you can have a rib head that's out of place. And we'll adjust that and we'll see how that feels in a second. The back part, this is really, so the main two expensive things in the shoulder are the rotator cuff. So that would be pain, right in here on this little kind of U-shaped strip right here. This is where all the 4 muscles of the rotator cuff attached, but that's not where you're hurting. And then the labrum is the cartilage in here. back here, this is called infraspinatus, right? This is a muscle right here.
Like rear end. It's not really painful on the touch,
Okay.
but there are times that it just has pain.
How about try to take your arm and lift it up inside. I'm going to resist you. Does that hurt?
No.
Okay. Yeah.
It was on the eccentric. It hurt a little bit.
When you relaxed,
Mhm.
it pulled a little bit.
Mhm.
A lot of that tissue in there, it's all replaceable.
Mhm.
You know, but it doesn't mean that it replaces well, or it replaces with the same material, or it doesn't replace tangled.
Right.
And so those are all just, I call it like stains in carpet that have to just be cleaned.
Right.
And it's not too difficult to I'll show you how to do that and everything. The main things in terms of long-term health of you is the discs. And that's where, you know, Ed, I'm here for these muscle injuries.
Right.
Fix my muscle injuries. I understand now, I'll fix them for you, but they're not generally what, the shoulder blade one is actually the most, it might not be your most chief complaint, but that's actually the most severe symptom you gave me, which is this guy. These two guys are a little bit more difficult because that indicates disc pressure. I'm more concerned long-term your health, the lower neck. And then actually the lower neck controls the blood flow and nerve flow to your shoulder. So the health of the muscles in your shoulder come from the nerve. Kind of like if a nerve is pinched, you'll have atrophy, right? So when a nerve is irritated, where that nerve goes to, the tissue won't heal right. You understand? It won't be right. And so we're going to go through your spine, clean your spine out, and then we'll also check out your shoulder and that pack and everything.
So now before we get
Please.
started, there is one like an alignment complaint that I have regarding my shoulder. So now the first one, you just caught it right when I walked in, right? So but in addition to that, there is both shoulders are just rounded forward.
Correct.
Significantly. In addition to being rounded forward, this side, there's an imbalance. I'm not sure you can.
So it's actually not, I mean, where you are right now, it's not rotated too far forward. You know, you're not, it's not like you're bowed like that. Does that make sense? That would be rotated forward. You're maybe a little bit, very slightly rotated forward. I would say your shoulder's here. You're just a little bit.
Yeah, exactly.
You understand?
Right.
It's supposed to be here,
Yes.
and you're here, but you're
Yes.
not.
Yeah.
I wouldn't say it's severe, but it's a mild rotation,
Gotcha. Yeah.
which, Ed, you know, I know you're an engineer and most of your work is in front of you, so a lot of that has to do with stretching. We have to stretch the ligaments on the front because they don't get stretched out as often.
Right.
The tilt is more of, it could be the injuries in the shoulder, but what I usually see happens is this: you have an injury to your neck goes into avoidance, and then your body has to have your eyes level.
Right.
So it's really a head tilt creating a shoulder tilt, which then does cause shoulder dysfunction and problems in the shoulders, but it's all ultimately from the neck not being.
That's, to be honest with you, that's the reason I'm here.
Yeah.
Because when I show this one to like, other chiropractors or other physical therapists, more often than not, they say the issue is back is not strong enough to pull the shoulders back. And it kind of made sense to me. So I worked a lot on my back compared to the front, which was just naturally more dominant, but that did not really solve the problem.
No, sir.
So the way you explained it in
won't.
your videos always, that made sense to me.
It won't work. It's not the job of your muscles to hold you upright. It's not your job of your muscles to be contracted to hold your shoulders back. You need to have good posture, and that's where you want to be. And when you're upright, actually really nothing should be contracted. When you're exercising, it contracts when it's used,
Right.
and then when you go to a relaxed upright posture, there shouldn't be contractions anywhere, right? It's not like it's contracted to have good posture. It's not the job. And then even if you do that, even if that were possible, now you have all this acidity that those tight muscles are creating all the time, creating soreness, inflammation. So let me look at the rest of your hips here.
That's not level either.
Yeah, I got a pretty good. Your right hip is high.
Yeah.
Right hip is a good ½ inch high. So you're doing.
Yeah.
You know, you're. I'm curious what's over here that's made you lean away from it. Do you understand?
Yeah.
Because it's really a couple things happen. It could be your head. Do you understand? And then the hips, everything are following. B.J. Palmer, the first chiropractor's son, worked almost exclusively on the upper neck because if the first two bones in the upper neck are not on straight, it creates a domino down to your hips. The lower back and the hips are an employee of the neck. And so I'm really curious to see what that neck feels like. Cross this arm under and over. Take a deep breath in for me. Go sit up. Head back for me. Let all the air out. Beautiful. Deep breath in. I got you. Head back. Exhale. Let it go. That's okay. Relax, relax. All right, deep breath in. One more. Exhale. Chin down. 1 second. Deep breath in. Exhale. Chin down. Very good. Very good. Okay. Everybody's moving. All right, other side facing me. Top leg bent. There we go. I'm just going through your spine, making sure everybody's working. Just assessing. Do you have all the employees working? Deep breath in for me. Exhale. Uh-huh. Uh-huh. Outside for me. Good. Uh-huh. Okay. Take a deep breath in. Exhale. Yeah, plenty movement there. Face up for me. Face up. Mine. Oh, sorry. The job of a chiropractor is to find the parts of your back that are slackers, the parts that are not working properly. The parts that are moving, excellent. You're saying, or the parts that are moving too much, we want to try to give them a vacation. But when I'm scanning right now, I'm scanning the 24 vertebrae in your back, finding who doesn't work.
Mm-hmm.
So your head is straight on your torso right now. I have a huge knot here on the right side of your neck.
Okay.
Feel this?
Yeah.
That doesn't exist on your left side. This is a whiplash or a soccer injury, or what sport did you do in high school? Something.
Nothing really. We didn't do sport.
Something hit, but I'm saying I mean, it's enough that it's in like almost like a little
Yeah, I feel it. Yeah.
ball of gunk in here on the right side of your neck. We'll get it moving, but it's pretty big. This is what's causing the head tilt.
Mm.
You understand? Your neck has decided to go left,
Yeah, right.
and that's why your left shoulder's high. Do you understand?
Yeah.
When I ask you to turn your head right, it requires this knot on the right to compress, and it doesn't. You understand?
Yeah.
When I saw you turn your head left, it turned farther. When you went right, it was because you're running into this knot up here. Okay, we'll get it. Go for it first. Here we go. I got you. There you go. There you go. Gotcha. You all right?
Yeah.
Yeah, very good. Very nice. Okay. So you notice when I was doing that, my hand's up here off the occiput. You're saying I'm contacting way up here. No chiropractor should ever adjust you into your lower neck. Because the lower neck, first of all, is where all surgery happens, and that's also the area that controls the in between your shoulder blade. The goal of my adjustment is twofold. One, we're trying to move the upper neck to take mechanical stress off your lower neck, and then also to loosen it for the purposes of restoring the lordosis and the arch in your neck. So it's wow, I mean, nobody's found this thing?
No.
Okay.
Because they didn't really do any of this. They just did adjustment.
I got you. But there's this right there. Oh my goodness.
Oh.
That. I mean, it clicks underneath my thumb a little bit. It's like a crunch. There. Watch, I'll show you. There's nothing on the left. It's like smooth. Does that make sense?
Yeah.
Like smooth sailing on the left side. And I have speed bumps, and there's a little guy there, but it's like maybe a third of the size or a quarter of the size. And then this right side, I have a house. Somebody put a house in here. I know, right? There. All right, see, your head doesn't want to even tilt to the right. Come on. There you go. You weren't born with this. Something happened. This didn't well, maybe it's just genetic, Ed. No, this isn't genetic. Something got whacked, and then it healed incorrectly, and now it has to be untangled. All right, come on. Because that would usually cause the left would happen first. So the right upper part of your neck is tight. You're going to wear out the left lower neck. And I think when you were telling me earlier, wasn't the left shoulder blade was the first one, right? So the abuse on the left lower neck will cause left shoulder blade pain, and then your body will compensate and move the hot potato, and then it probably shifted over to the right. But I would say the first abuse or pain that this will create is left lower neck, left shoulder blade pain, because you're excessively stressing out the left lower part of your neck because you're in right neck avoidance.
Yeah.
Okay. Right there. All right. We have a device called a neck Deneral, and I'll show you that in a minute. That's going to be your toothbrush we're going to use to to model and emulate my thumb, and you can basically, I want to teach you how to do this at the end of the visit, how to, have a tool that can, as close as possible, hold you, makes sense, in the correct position. And then we mold this arch back to your neck. And that's where we're headed. We got to first soften your spine so that it's limber enough that we can actually change its position. If your spine is all stiff, then it won't, the stretching isn't very effective. Okay. There you go, let it go. Yeah, here it comes. Right there, feel it? Yep, that's all.
It's pretty dark.
It's good. You just gotta, both sides are clogged, but the right one is definitely more.
So how often this should be done?
The way we're gonna, when there's a curve in your neck and the upper neck is moving, you shouldn't need to gua sha the neck all the time. It's like if you take your shoes off at the front door, your house won't be dirty and got mud everywhere. You understand? The goal is to teach you how to stop walking around the house with your shoes on so that there won't be so much mud tracked in. The alignment is incorrect, and that's what's creating the buildup. And many doctors or therapists will just want to just keep sweeping and cleaning, and that's not a bad thing, but it doesn't get to the root cause, which is your head's tilted and you have no curve in your neck, and those are the problems. I would say you got a military curve, and that's part of what a lot of athletes, when you're exercising a lot, it's most likely your neck goes straight, so you don't have much forward head posture, but there's no curve in your neck, and so you still have there's two things that happen: the tethering, the nerve roots are held tight, and the joints are under a lot of stress in the lower neck from the alignment not being correct. So even though the head's not forward, the military neck isn't correct either. Aren't you happy yet? It's over the no, because it's not curved, right? So the bar's even higher than just that. Everything in here replaces, but like I said, it doesn't replace with the same stuff.
Yeah.
So our body was made from gold, and then we heal with copper.
Yeah.
Right. So maybe like a street, right? When a street gets damaged, you get a pothole, they fill it, but the stuff they fill it with isn't the same stuff that was.
Yeah.
And it never feels right. Do you understand?
Right.
Now that doesn't mean we give up, but it does mean we can smooth it out and we can make it less noticeable, the transition between the uninjured tissue and the injured tissue. And something like 90-95% normal is what we can achieve. You understand? It's like a dent on a car. Sometimes I know there's some really good PDR, they call it paintless dent removals, and I've seen magic done work. My dad had a speaker fall off a shelf and land on the hood of a car, of his truck, and they pulled that dent, and you couldn't even tell. But my point is, unless you have like some professional do it, most of the time you pull a dent, you can kind of see a little bit of a ripple, you understand, that there used to be an injury. And in our human body, there's always like a little bit of evidence that it's like a scar on your skin. Your skin remembers, and internally when you tear tissue, the tissue inside remembers. Yeah, right there. There's an injury right there.
That's exactly what it was.
It's easy to find them because the body, it's like rubbing your hand over skin. You can feel the scar. Do you understand? You can feel where the scar is inside because it's all tangled. And kind of the first way of treating it is, do a couple rounds of gua sha on it and see how, and then when the marks go away, how it responds and how it feels as it untangles and stretches. And I feel like the body tries to like pack the wound quickly to like stabilize it, and then it's like, well, it kind of says it itself, over time I'll go in there and remodel it later.
Right.
You know, kind of like an old saying, I'll do it when I get around to it. You know, I'll do it later. And so then your body gets so, I don't know, occupied with other things that it never really goes back around to it, to something like that. I don't know. That's my thoughts on it. So by working on it, we can shine a spotlight on it and get your body to draw some attention to it.
And that front of that shoulder really hurts.
This is the AC joint. You're jamming the acromioclavicular joint, you know, over here. This is where all the, you know, this is the connection between the front and back part of your body. And you're an athlete. I expect the AC joint to be a little.
But you also mentioned in your videos that like when the shoulder is forward,
You jam this.
Right,
Yes,
jam
sir.
this, right.
Yes, sir.
So that's
You have that happening too.
right.
There's your AC joint jam right there. That's where all this. Yeah, there's definitely right in there that little crunch. There shouldn't be any. You know, kind of like right there, a little
Yep,
bit of a crunch
right
in
here,
there.
yep. So the fact the shoulders are forward is trying to avoid something in the back.
Well, yeah, that can be. It could be, yes, you could have an injury in the posterior part and then that rounds forward to go away. But I would attribute most of it to just simply the exercises in the gym being more predominantly forward and life in general being forward. When we were growing as a teenager, we were sitting rounded forward. And so our life is more inundated with things rotating our shoulder forward than backwards.
Yeah.
So
Yeah, I mean that's
Could
like
be.
in my when I was in high school, we had to study a lot. Like I was like
Right.
sitting like 12 hours a day
Right.
studying like for and that at the time I wasn't doing like any exercise or anything.
let that arm stretch. Yeah, let that stretch. It's like, did I do something to have plaque form on my teeth? It's like, well, no, it's what you didn't do. You weren't. Nobody taught you that you have to brush your teeth, and then plaque was inevitable because we weren't. You know, our world didn't guide us on. You know, first of all, like I said, taking your shoes off at the door, and then how to brush and how to sweep.
Like you always say, like when you were kids, your dad.
Yes.
Always, like that's right.
Right away, we got adjusted. Yeah, we wouldn't wait months or years. You know, it was like, you know, soon after, it was so we didn't heal crooked, right? Because the compensatory injury is actually the more of a much larger severity is the effects of an injury, not even so much the injury itself.
Yeah.
It's the posture change. You know, those are the more lasting long-term effects. And I know in terms of time-wise, I'm going to spend more time on other parts of your body today, but actually the neck was that was actually the biggest injury in terms of what.
Yeah, that's like you said, it all started it, right?
Well, that's actually going to be the thing that's going to still be here later in life. Do you understand? That guy is going to be the hardest guy to get rid of.
Right.
The shoulder, schmolder. Do you understand? I'm not. You stop working out so much, it'll go away. Does that make sense? Kind of idea. It's part of it. You're an athlete, and you're really asking your body to work real hard, and that's great. But I'm just saying, the spine won't be something that just not doing stuff will remedy. Do you understand?
Yeah.
Like I'm not working out anymore, but my neck's still killing me. My shoulder pain's gone away. The neck isn't that simple, and that's why I'm in terms of what to making it to 90 years old. That's going to be our bigger monster. The spine controls all the health to the tissue anyway. So when the spine gets agitated, you know, the extremities get agitated. And the extremities are the boss of no one. They're being bossed around by your spine and your nerves. Wow, whoa. So this is all popped up. Now this is going again with, I was saying earlier, there's something on his left side that's being avoided. Do you understand?
Yeah.
You're tilting to the right, and you actually would abuse the right lower part of your back because of this. Now there's a head tilt going on, but we also have a back tilt. Now I would say this is a reflection of the neck. Do you understand? This creates this, but this in and of itself is going to create a bigger problem.
Right.
And our world, sorry,
No, you're good. I'm just
our world doesn't care until you herniate a disc down here. Do you understand? And then all of a sudden, everybody gets on board with me and goes, yeah, his back's not healthy. Right?
Yeah, that exactly that right upper.
It's huge. It's huge.
Right, upper
Huge.
right is where when I do like deadlift and things like that gets always.
You're abusing the right.
Abuse.
If it had been here till 41, it would now be frozen. Do you understand? If you waited another 10 years, it would be crooked and frozen.
Mm-hmm.
Right now you're just crooked, right? But it hasn't locked down completely yet. Because you're not in the right position, the joints are going to be under extra stress, and then that's going to force them to lock themselves down. And then the end game is always lumbar 4, lumbar 5, and cervical 5, 6, and 7 end up with 99% of injuries happen in 5 vertebrae. And it's the very reason that these areas are not moving that allow those areas to be beat up and abused. So restoring the function to your middle back. You'll feel it when we stretch in a minute. You're going to feel like you're not straight on the device. Like, I think your roller's crooked. No, the roller's not crooked. Your back's not level. And as you progress on your stretching, you'll notice that it'll feel like it's level again. You won't feel crooked on it. But yeah, I'm sorry nobody saw this huge left side. Your back is all numb.
I do use foam roller a lot on my back.
Correct, I understand. But even that isn't powerful enough
Yeah,
to do it
yeah,
unless you've been
exactly.
softened first. The roller is more of a retainer, you know? You have to be worked on and the tissue made supple, and then you can, work it yourself a little bit, but mainly retain it to prevent backstepping, so that the next visit I can keep moving us forward. I mean, yeah, this is lifted up right here. These joints are under some stress. I mean, that right there that joint's not happy. Like right here. Yeah, but these are the roots of your neck also. So because your head's tilted, you understand your head's tilted to the left, you're going to abuse this. And then you're tilting your torso to the right. It's just dominoes its way down. But you got right there. I go home and I sleep very well at night because I gave my patients everything. And I think you could have gone a little harder. No, I really couldn't. That was it. I gave them everything.
Yeah, no, this is really more intense than it looks on the camera.
Aw.
Yep. Yeah, I don't think I could hurt you on the side as well. You're a little more invincible over here because it's already moving. It's not as painful. The left is more stuck, and that's why. Yeah, I don't think I'd hurt you on this side. This side's already. Jeez. There's muscular injuries on top of them. It's just tangled. It's all tangled in here. Nice and smooth here. Look, it's like
Yeah, a lot of that, the upper head mobility issue I told you on the left hand side,
it's a
it
mess.
seems like because of that jammed up everything.
It's a mess. Oh. Yeah, you've busted this. Yeah. I mean, can you feel the difference? I mean, you've torn this muscle. Lecture arm. Feel the difference? This is not nearly as contracted.
Mm-hmm.
I mean, look, that's just an absolute. It's never getting in. It's like you're leaving the engine running all the time. You're never turning the engine off. It's got a high idle, and the amount of acidity in the tissue is going to be enough that it's going to cause just pain in a broad area around it. Because now part of that is when you have an injury, your body expects it to happen again, so it puts up walls and it tightens itself in anticipation of another injury. And so it's part of it's that we have to convince your body that it no longer needs to keep the area in lockdown. You put it back up there. Yes, it's back better. There we go. You talk about a hard spot to do it yourself. I mean, yeah, it's all. You gotta get that acidity out of there. I got you. Hello. Feel that? That's an injury. Feel the difference? See, soft,
Yeah,
soft, soft,
yeah.
injury. You tore it. It healed with scar tissue. Inside there's soft, and then nothing. There's nothing. And then right here,
Yeah.
it's kind of where you're pointing. This is soft tissue. Tangles. Ugh. So in this area, some of the fibers go laterally, like the rhomboids, they go left to right, and then the spinal muscles go up and down. So you kind of, and the gua sha is taught in different, depending on which angles you want to, which muscles you're trying to address. But in this area, both directions are okay because the spinal muscles go up and down, and then the rhomboid muscles go side to side, so you'll see me working both directions. In the beginning of my practice, I used to say that something like 50% of pain is from the soft tissue, and I've revised that over the years to something like 80% is not measurable on an X-ray or an MRI, but it contributes heavily to actually your presenting symptoms. And I don't know, just nobody talks about it. It's like we want everything to be quantifiable and measurable on a blood test or a picture, and if it doesn't, it's like it doesn't exist. But it's like, no, this exists, but it's outside the realm of what can be. It can be felt and palpated, but it can't be measured like on a imaging or a blood test, because it's not inside the circulatory system. It's in the muscles, it's in the interstitial. But yeah, both sides were. This is what he was pointing to when you were upright. He was both. I think this is the spot that he was.
Yeah.
Yeah, this is the second spot right there. See, the mobility of the vertebrae is what keeps it clean, and so even though it moved, there was still some restriction here, and so if we get the area moving a little better, it should clean out for you. You shouldn't have to have constant need to, and we'll do that also through stretching. I got you, bud. There it is, nice. Very nice. Look at all that. That's where your spots. You got to get that out of there. That's contributing a large percentage for why you're feeling what you're feeling, and then keeping it out of there through the stretching and adjustments is the goal. Breathe. Exhale. Wow. Yes. Get the idea? Right? We got to actually arch your back to get those. I sat on you and it didn't move, right? But when I arched your back, I actually got it to go into place. All right, bring your arms up for me. Put your forehead right there on your forearms. Here we go. All right, breathe in for me. Here we go. Exhale. Stretch. Here we go. Very nice. Wow, that was one of the best ones. I hate to say that, but that was actually one of the best. You all right?
Yeah.
That was phenomenal. I mean, that was really cool. So I couldn't even adjust that face down.
Yeah.
When you were flat, I put all I had into it. Nothing moved. Then I had to arch your back. And then you get it to move, because it's so. Now it should move face down. It shouldn't need that. But the goal is, if after a few times doing that and stretching, it'll then move better for you, or that will move already. See, that should have already moved. There shouldn't have been any more air left in the joints. But there's a part of the joint that you're never really accessing that's got a bunch of crud in there. You have to. It's like you're going here, but then I want.
Oh boy.
You understand? I want more.
Yeah.
But you never access that because it's not really needed. But it's the full potential of what you should have.
Right.
What do I say? Like it responded to. It said, "Okay, I see." Like it said, I see what you're trying to do. Fine. There you go. Okay, I got you. Very nice. Yeah. You've injured these guys a little bit. There we go. Okay. I got you. Relax. Ooh. Yeah. Head to the left a little bit. Tilt left. Tilt left. There we go. Tilt left. Good. All right, go ahead and tilt your head right. Tilt right. Tilt right. Tilt to the right. Nothing on the top. Okay. I'm just curious. Check this shoulder. See if I can get something out of shoulder adjustment wise like this. All right. Look up for me a little bit. Now press back with your elbow into my elbow. There we go. Nice. Press back. There you go. Yeah. All right. Let me have you come over. Do you have a foam roller? Do you have?
Yeah.
Okay.
I have one of these too.
You have a dental roll? Okay. You want to, it's the den roll, you're only in one position. You're trying to do like a detail clean of a small area. The roller allows you to move around and you're kind of scanning the back. The idea with it is that you would scan your back with the roller, identify the stiffest part, and then put the den roll on it. And the goal is 20 minutes. You're not going to see any permanent change until you're getting to 20 minutes. You have to achieve the ligament stretch at 20 minutes.
10 minutes for every spot.
Right. Well, every time you get on it, 20 minutes, different spot. You got a lot of spots. Potentially, 10 vertebrae have to be. And so, the most bang for your buck is on the stiffest spot, right? So, and then that'll move. Where the stiffest area is, will as you do it more. Now it's over here. Now it's here, and then eventually there's no spots anywhere, and then it's easy in every vertebrae. The difficulty is that to address the spots that you had symptoms in, you need this guy. But the biggest misalignment that you have is where I have it now. Do you understand? Now that doesn't mean that you can't. I want all the spots worked on. But if you were here in Sarasota, I would first address the largest stains. You understand? The largest misalignments, that left middle back. Feet together, knees left. Rotate, yeah. Yeah, you got to stretch that out. And then compress, good. Knees back to the right. There you go. I want, knees back up, there you go. I want this to be easy. This should be just...
Yes, the left hand side was actually pretty easy. Right hand side a little bit.
You're stretching out that left side when you do that. I got you.
A little bit, yeah.
I'm just curious. Let's go a little bit lower. There you go. Let's go there. Yeah. Good. Yeah. 20 minutes. This is, as much as I'd like to say that I can change your posture and fix you, I really can't. My job is to make you limber. You understand? To lift you up, get all the vertebrae moving so that your range of motion is higher and you can stretch deeper and change your posture more effectively and better on the stretches. That's why you get adjusted and get all that inflammation out of your back so you can feel a little better while you do the postural work, which takes 6 months, a year. Do you understand? To change your posture permanently, it takes at least 20-minute stretches to do the first checkpoint. I think of it like 3 months. You get about half of where you should be in 3 months, and then the next half takes about a couple of years. So it's a diminishing returns curve. So breathe, exhale, roll to your side, and then roll back on your back. Roll back on your back now. There you go. You okay? Hey,
Yeah.
Very good, very good. I can tell you've been working on it. Let's try this guy. A little sit up for me. There we go, right there. There we go, yep. There you go. Knees bent. With this, you do a little bit, arms up, do a little bit of a tissue pull downwards. That make sense? Is that too easy?
That's not too easy, okay.
So with the neck one, it's just the same kind of idea. You're kind of middle upper neck. What I usually do is the legs are straight on this guy, and then lay back. I got you. Pick your hand, put it on your forehead. And you're gonna actually, your neck wants to go to the left. You want to work on actually going to that right. Maybe you can use this hand.
Yeah, actually, I do that too. I do always try to go a little bit.
Maybe not so far. Just a little bit right. Do you understand? So when you're on it, be back and to the right to push more on that right side. I usually say this is like a 1 month prescription because you can make it go the opposite way if you do this too long without being checked. How you feeling?
Feeling great.
Yeah, very good.